Happy Friday, everybody. It's Dr. Galvin with today's coronavirus update. As usual, we are going to start with the numbers. 2.2 million cases worldwide, 145,000 deaths, 550-ish thousand recoveries. In the U.S., 675,000 cases, 35,000 deaths. Here in North Carolina, 5,600 cases, 145 deaths. Today we are going to talk about some challenges that we may face for reopening, some challenges about what the actual infection rate and death rate is of the virus, and also we're going to talk about the risk of obesity and the virus. But before we do that, I'm going to have to ask your help. So we've been putting out these videos and I probably get several hundred questions every week from folks, and I'm trying to answer them. I'm trying to figure out a good way of doing that. And so we've had some input from other people, and apparently YouTube is the best way for us to put short videos that answer specific questions. But I guess in YouTube, you need to have 100 subscribers in order to get a URL that's like your name, not some random thing of numbers. So if you appreciate this, if you want to help me out, if you could go to YouTube and search for Vitality Medical Wellness Institute and subscribe, and there's a little bell or something. If you could subscribe to it, we'll get our 100 members, and then we'll have our URL that's actually our name. And what I'm going to start doing is I'm going to film answers to these questions, and I'm going to post them there so you can actually search it, because on Facebook you can't really search for specific things. And so that'll be a way that we can sort of have a library of answers to common questions, and if you answer that question, we can point you over there and your answer will be ready. So, reopening challenges. We've been kind of on this theme this week of how do we get the economy going, and Trump has said a bunch of stuff and it sounds like, oh yeah, we're going to be able to go. Well, can we? I mean, that's really the question. Can we go ahead and reopen? And I've got, there are protests starting now, and I think we've got to understand what we're dealing with. We may have to go back to the roots of this virus. Why are we worried about this particular virus more so than flu, than swine flu, than H1N1? The problem is that it's potentially very deadly, meaning that a high percentage of people, much higher than the flu, at least 10 times higher than the flu, maybe several more times than that, are going to potentially die from it. And the second one is it's very transmissible, meaning that lots and lots of people can get it. And to reopen the country is going to require a level of surveillance and testing that we just as a country have not been able to really show that we can do. Because the only way we can really tell people they can reopen is that we've got to be able to identify when the virus levels are dropping, when the infection rates are dropping. And I think the guidelines that came out from the government said that you need to have 14 days of decreasing numbers of cases before you can start pulling back restrictions. That's because that's the maximal incubation period of the virus. What happens if you go too soon? Then you're going to have another spike and you have to restart all over again. So, what does that time frame look like? Well, we don't really know, and we can't get great information until we both are able to test who's got it better, and more importantly, the antibody tests that I keep talking about. And I think there's a great local example of what can happen. So in the paper here locally today, there have been 19 new cases, and guess what they were tracked to? 3 events: a birthday party, a small wedding, and a family Easter celebration. So people that broke those self-isolation rules, and the groups were small, 10 people or less. Small groups, 19 cases. So that's a concern. We'll talk a little bit about death rates as we move along, and you can see where that gets into some more examples. So right now, when we first started talking about this several weeks ago, I think you may have remembered, I was fairly pleased with the fact that the case fatality rate in the US was much lower than Italy. In Italy, it was, 10-12%, and in the US it was 1.45%. But if you look at what the case fatality rate numbers in the US have done, they started out at 1.35 in late March, and then in mid-April, April 15th, they were at 4%, and just yesterday, today rather, they were revised up to 5% because of a spike in cases in New York City. So now we're at a 5% case fatality rate. So if 5%, if that number's true, that's hundreds of thousands of people. I mean, in the U.S. it's what, 1.5 million potential deaths. Now that's probably not the real fatality rate because of the fact that there are a lot of people that are going to get a very mild disease and may never get tested. And if you don't get tested, we don't add that number in. And there was an interesting study that came out of Southern California. Let's see where my notes say. From Stanford. And they did some random antibody testing in 3,300 people in the Santa Clara Valley. And what they found was that 2.5% to 4% of those people had antibodies against COVID, even though they didn't have the disease. And so that means that was 50 to 85% higher than what we would expect. Now, that's good news in the fact that it sounds like, according to that study, which has not been peer reviewed, and so we don't really have great data, but it's interesting, right? The fact is that there may be a lot of people that get the virus and then have almost no symptoms and then get better and have antibodies against it. Now, we don't know 100% sure that those antibodies protect you from getting severe disease, but we think it probably does. But even at the best case, 4%, what numbers of people need to have antibodies for the risk to be gone, for us to achieve herd immunity? Probably 70%. So we've got a long way to go, even if the number of people that have actually been exposed is much, much higher than what we're predicting. The only way we're going to know is by testing. The Chinese have revised their numbers up after finally acknowledging that they're not going to tell us that they've been cooking their books, but we think that the Chinese numbers are far, far above what they've been reporting, and they just revised the number of deaths in Wuhan up by 50%, but they're still saying only 3,000 people died in the epicenter of where this started. The French have shown a fairly significant increase in all-cause mortality among the elderly. What does that mean? Well, we would expect a certain level of deaths in the elderly at any point. Suddenly they had this big spike. Well, what's changed? Well, the coronavirus. So those revisions of New York that they're now classifying a lot of these people that died at home with corona, those are deaths in excess of what they've seen consistently. So if you suddenly see a spike in 4,000 at-home deaths when everybody's sheltering in place because of a pandemic, then it's not a leap to say, well, those 4,000 deaths were probably caused by the pandemic because there's nothing else going on. What's the real infection rate, the actual infection rate? I don't know, but it's probably population-wide going to be 0.1 to 0.3%, but still, it's a lot of potential death. I think that's 400,000 or so. My math might be wrong. Now, the last thing, obesity. There's a study that came out of NYU that looked at obesity and admitted patients. So these are people that were sick enough with the virus to need to get admitted to the hospital. And they found out that obesity was a bigger risk factor than either hypertension or diabetes. Now again, preliminary, not peer-reviewed, but there's been some other studies. There was a study out of China that showed that 15 of 17 people that died of coronavirus in a particular area were obese. And there's a pretty low rate of obesity in China. And then in a French study showed that half of their COVID-19 patients that were admitted were obese. And again, France has a much lower rate of obesity than the US does. And what we're seeing in the US is a higher number of people who are less than, say, 55 getting hospitalized for the virus. And we think that maybe obesity is that missing link. And so it's an important thing. In my normal job at Vitality, weight loss is a big thing. I'm actually board certified in obesity medicine. And we are currently working on an online plan to kind of help people who are locked at home, gain weight, to lose weight and get healthier. Both, the 5 kind of key things that we look at are nutrition, fitness, sleep, stress, and oftentimes hormones. It's hard to deal with the hormones with an online program, but we can deal with the other 4 pieces. And so I'll be talking a little bit more about some of the options that we have. We've got great health coaches and we're learning how to do really good online coaching. And so more of that's going to come. If you like the video, please like our page and follow us. But more importantly, if you could please help me out and subscribe and hit the little bell for YouTube so we can get our 100 members so that we can get our own little URL so we can link to it without a bunch of characters and numbers. As usual, wash your hands, wash your hands, wash your hands. Take care of yourselves. Take care of your families. Take care of everybody else. We're going to get through this. I'll be back tomorrow. Have a great night.